VISHNU IAS. Today, our topic of discussion is Dravidian model of public healthcare. Recently, Supreme Court has given a historic judgment which upheld 27% of reservation for OBCs in PG category of NEET. In this context, Supreme Court has also said that merit should not be just looked in a competitive perspective. Public dedication should also be considered as merit. Merit should be reconceptualized in a way which advances social goods like equality. In this context, we will look at what Tamil Nadu government has been doing since 4 decades. Tamil Nadu government has a reservation policy which allocates 50% of seats for PG and super specialty courses to the doctors who have been working in government service. This has been a tremendous impact on public healthcare. 1. It has strengthened tertiary and primary healthcare to a greater extent. It made sure there is an availability of doctors in every case in rural areas as well as urban areas. Therefore, it balanced the screwed relationship which has been existing between the rural and urban healthcare. This also has ensured that there are 900 super specialty doctors today in Tamil Nadu, which is almost par of any European countries. Tamil Nadu government also ensures that there is a primary health center and primary health care by putting an eligibility criteria of 3 years for government doctors to be working in primary health centers. This has also strengthened the primary health centers to a greater extent. There is a win-win situation to both doctors and the government. The students must sign a bond which says they will work with the government till the end of the resignation period. With this, the students are ensured that their place will not be taken away and the government will be ensured of the brain drain doesn't happen to either private sectors or to other countries. This policy has made an extreme important situation in our country where there has been an extreme skewed relationship between the urban and rural availability and affordability of public health care. When there is a strengthened public health care, you will be ensured that the services are accessible and affordable for every individual. But there has been a glitch. Under new NEET rules, there has been told that the PG only diploma courses are under reservation for 50%, therefore rejecting the 50% criteria for PG students and super specialty students, and this has to be ensured. Now, will the government act according to the guidelines which the Supreme Court in its recent judgment has passed, or will it continue with its regular NEET rules is something we have to be conscious about. Thank you.